Chapter 16, Patient Education. Disclosure: I do not own any of this material. This material is for my students' educational purpose only. Teaching clients is part of independent nursing practice. The basic purpose of teaching and learning is to provide information that will empower clients and families to 1. Perform self-care, and 2. Make informed decisions about their healthcare options. Like other interventions, you can use teaching to promote wellness, prevent or limit illness, restore health, adapt to changes in body function, and facilitate coping with stress, illness, and some standards from the American Nurses Association states the registered nurse seeks knowledge and competence that reflects current nursing practice and promotes futuristic thinking. Registered nurses' teaching activities include: they provide health teaching that addresses topics such as healthy lifestyles, risk-reducing behaviors, developmental needs, activities of daily living, and preventative self-care. The nurse should use health promotion and health teaching methods appropriate to the situation and the patient's values, beliefs, health practices, developmental level, learning needs, readiness and ability to learn, language preference, spirituality, culture, and socioeconomic status. At the same time, the nurse seeks opportunities for feedback and evaluation of the effectiveness of the strategies used. So, as we spoke in class, we are responsible for teaching our patients. We are responsible for assessing if they're ready to learn or not, whether they've been to college or whether they've only been to elementary or high school, whether they know English as a second language. We need to take these factors into consideration because depending on our assessment, that's how we're going to teach our patients. And once again, in the evaluation process, how do we actually evaluate? How do we know that the patient actually learned what we taught him? Well, the best way that we can actually know if our patient actually got and understood what we've just taught or educated them on is by having them teach back or by having them demonstrate back to you. Like we said, if you teach him how to administer insulin to themselves, then you do what we called a return demonstration. They would then have to do a demonstrate to you how to actually apply, what sites, and they would have to tell you and explain to you how many units and so forth. The Joint Commission goes on to state that nurses have an obligation to consider the literacy, desire and motivation to learn, developmental and physical limitations, barriers to communication, culture, and religious belief of every patient. The American Hospital Association Patient Care Partnership, previously the Patient's Bill of Rights, describes in plain language the right of consumers of accurate and easily understood information about health plans, healthcare professionals, and healthcare facilities. If patients speak another language, have a physical or mental disability, or just do not understand something, they have the right to receive help so they can make informed healthcare decisions. So, why is patient education so important? Well, nursing is not just about dispensing medications or administering treatments. Nurses are also responsible for educating patients for preventing and managing health conditions and promoting their own health. With health information, nurses help patients take control of their health care. So, by education, we empower patients to take control of their own healthcare. It improves patients' The three domains of learning. We have the cognitive, the psychomotor, and the affective. We're going to start with the cognitive. So in the cognitive domain, we store and recall information such as facts about a disease. The cognitive domain is divided, or it ranges from the remembering to the creating. At the remembering level, you're able to memorize, define, and recognize. At the understanding, you're able to understand, summarize, and interpret information. At the applying level, we're able to use abstract ideas and implement them. This is where we want our patients to be. When we teach them at the cognitive level, we want them to be able to actually apply it. All right? So the other domain of learning is the psychomotor. This domain includes hands-on skills. This requires thinking and doing, such as self-administration of insulin. So for us, in theory, we can say that we are at the cognitive level. Then we go up to the lab and we do psychomotor. That would fall under this domain, is hands-on skills. It requires a person to actually demonstrate how to use or apply the cognitive level of what you know. The affective domain deals with beliefs, attitudes, values, and feelings. The theories of learning. We have the social learning theory, which explains the characteristics of the learner. It talks about how self-efficacy is a major concept in social learning theory. It refers to a client's perceived ability to successfully perform a task. Behavioral learning is characterized by explicit identification of information to be taught and immediate reward for correct responses. It has its roots in psychology and the belief that the environment influences behavior and, in fact, is the essential factor in determining human action. The cognitive theory sees learning as a complex cognitive mental activity. Learning is an intellectual or thinking process in which the learner structures and processes information. Cognitive theory also recognizes the importance of developmental stage and social, emotional, and affective influences of learning. Humanism emphasizes the learner's active participation and responsibility in the learning process. Learning is thought of as self-motivated, self-initiated, and self-evaluated, and its purpose is self-development and achievement of the learner's full potential. The 5 rights of teaching. You have the right time, right context, right goal, right content, and right method. For the right time, you gotta ask yourself, is the client ready, free of pain and anxiety, and motivated? Have you and the client developed a trusting relationship? Have you set aside enough time for the teaching session? For the right context, you gotta ask yourself, is the environment quiet, free of distraction, and private? You don't want it to be like a noisy environment or have like interruptions, right? For the right goal, is the client actively involved in the planning of the learning objectives? The right content, is the content appropriate for the client needs? This goes again back to assessment of their educational or cultural or developmental level. For the right method, do the teaching strategies fit the learning style of the client? So we gotta see how the client learns. Like, do they like maybe just written material? Do they like maybe videos? You gotta, ask yourself that. Which method is gonna be the best for this client? Factors that affect client learning. Motivation. Are they actually motivated to learn? Readiness to learn includes the physical condition. Are they in pain? If your client is in pain, they're not going to be motivated to learn. Their emotions, are they anxious or stressed? The timing, as we spoke earlier, the timing has to be a time where you and the client have enough time for the planned education that you plan to implement. The active involvement. It is said the learning is more meaningful when the client is actively engaged in the planning and the learning activities. The feedback given. Positive feedback encourages learners and boosts morale when it comes to tackling difficult content. So we always want to make sure that we give our clients positive and supportive content. The repetition. The client is more likely to retain information and incorporate it into their life if the content is repeated. The learning environment. Is the environment private? Is it quiet? Is it free of noise? Is it comfortable? Scheduling of the sessions. So, have you planned for uninterrupted time to allow you to adequately assess and understand the client? The teaching time does not need to be long, just it has to be one where you're not interrupted. The amount and complexity of the content. You want to make sure that the content is simple and that you don't take too much time, because obviously the time span of some clients is not going to be there. So sessions, you want to make sure they're from 5 to 10 minutes. The nurse-client communication. Barriers to communication include pain, anxiety, hunger, language differences. We got to consider those special populations. So the adaptations you make will depend on the nature of the special needs. So if you are not familiar with the client's condition, you must acquire theoretical knowledge of it, include a family member, caregiver, or other significant person in the teaching to reinforce learning and act as a safety net for implementing information. Developmental stage, once again, if it's a kid, you want to make sure that you give them, materials such as videos, or that you do it in a playful manner that they're able to engage. And then also their health literacy. You want to make sure that you speak to them at a level where they understand. So you don't want to be throwing out terminology such as hypokalemia or hyperkalemia. You want to say, oh, you have low potassium or you have high potassium. Barriers to teaching and learning. It could be time to prepare for the teaching. I know that when I first, started working as a nurse, I was trying to manage time, and on top of this, I had to do patient education. And trust me, when you have 4 or 5 patients, you are really busy, and just, finding that time to prepare for the teaching can be challenging. Also, conflicting schedules between the nurse's available time and the patient's available time to learn. So what about, for example, if you plan to teach the patient at, 9 a.m. about a specific procedure and so forth, but then you go in the room and you see that speech therapy or is in the room, or there's a chest x-ray being taken at the time that you planned for the teaching. Barriers for the patient include illness, fatigue, or other physical conditions, anxiety, the environment, the lack of time, the language barrier. Barriers to teaching with technology-based learning include access to the internet, technical problems, time issues, diverse learning styles. Some people might not be willing to, are not willing to learn through a computer or an iPad, especially or older population. Suppose you are the nurse planning discharge, teaching to a frail, elderly man who suffered a stroke. He will be cared for at home by his daughter. What is the best approach for planning discharge teaching? How might the nurse show caring for this patient? The nurse knows the best approach for planning discharge teaching is to include caregivers or family members who will be involved in the care of the patient after discharge. You want to be able to create a non-threatening environment for learning. Reduce the distractions in the room before start teaching. Speak slowly using normal voice volume, not loudly unless hard of hearing. Cover need-to-know information only. That is, in this situation, the skills that are needed to support the patient's activities of daily living, safety. Be sure you provide teaching when he is rested and can pay attention to what you're saying. Timing is very important, especially for frail, elderly patients. Present little information at a time in order to not overwhelm him. Phrase instructions simply with action words. Avoid abstract words. Printed instructional materials might be helpful to this older adult or family caregiver as a way to reinforce the information and remind them of the discharge instructions. Use repetition and reinforcement. Show back return demonstration is a good way to know if he understands correctly. The nurse can show caring by allowing plenty of time and not rushing him, providing a private space to teach the client and his family, making sure the patient is comfortable, rested, and pain-free before providing information, and considering his life experience. Safe, effective nursing care promotes safe self-care, shortens hospital stays, reduces errors and medical complications, and prevents rehospitalization. Clicker check. Nurses must possess the knowledge and skills needed for patient teaching so that A. They can complete the documentation forms related to the client teaching accurately. B. They can help the hospital meet the Joint Commission standards requiring client teaching. C. They can promote the health, safety, and rights of clients through education. And D. They can meet the patient rights delineated in the patient care partnership. I'm going to go ahead, give you a couple seconds. The correct answer is C. According to the ANES Code of Ethics, nurses are responsible for promoting and protecting health, safety, and rights of patients. Patient teaching is essential in fulfilling that responsibility. All right, clicker check, continue. The client needs to be taught how to find and check their own radial pulse. The nurse will complete this teaching A. Only if the client asks the nurse to do so to avoid causing stress. B. When the client recognizes the need to learn the skill. C. Before pain medication is administered when the client is alert. D. Right before the client is discharged so they can remember the skill. I'm going to go ahead and give you a couple seconds to look over these. You can pause the video if you'd like. Okay, the correct answer is going to be B. The client will be most motivated to learn when they recognize why this skill is important to the success of his overall treatment plan. Example, medication effectiveness. These are going to be the components of a learning assessment. You want to know who your audience is. Who are you teaching? What is the client's age, occupation, developmental level, and cultural affiliation? Will you be teaching a person or a group? You want to know their learning needs, such as what is the client's medical or other problem? What behavioral changes are needed? What self-care knowledge and skills does the client need? The knowledge level. You want to determine what the client already knows so that you can reinforce knowledge or adapt the teaching plan to the client's learning needs. Ask questions such as, what do you think caused your health problem? What are your concerns about it? How has the problem affected your usual activities? What are your concerns about treatments, tests, surgeries? And the health beliefs and practices. Ask the client to give general description of their health. Ask, what do you usually do to stay healthy? What problems do you think you are at risk for? What lifestyle changes would you be willing to make in order to improve your health? Their physical readiness. Check ability to concentrate and, pain level. Emotional readiness. Find out whether the client is experiencing anxiety or emotional distress that will interfere with the learning process. Ask the client whether they would like a family member or friend to be present during their learning. Their ability to learn. What are the client's cognitive and psychomotor developmental abilities? How does the client learn best? By memorizing? By problem solving? By applying information? How well does the client recall previously presented material? The health literacy level. Does the client have the ability to understand basic health information and services needed to make appropriate healthcare decisions? Can the client read and write? Does the client and healthcare provider speak the same language? Their neurosensory factors. What is the client's ability to feel, see, hear, and grasp? Does the client have a medical condition that causes neurosensory compromise? Their learning styles. Ask the person, how do you prefer to learn new things? For example, do you prefer to read about them, to talk about them, to watch a DVD, be shown how to do it, listen to the teacher, or use a computer? Do you like to read? Clicker check. The client is given a pamphlet to read about how to manage their newly inserted central venous access device at home. It will be most important for the nurse to assess the client's health beliefs, literacy level, fine motor abilities, ability to see. All right, let's think about this for a minute, okay? So you want to go back to the first sentence where it says the client is given a pamphlet. So now that we know that we gave him a pamphlet, what do you think is going to be the answer? What do you think is most important? Well, I'm going to go with answer D. And it's going to be D. If the client has vision problems, the nurse will have to find another strategy to convey that information. Evaluating learning. So one thing that I want to say about evaluating learning, there's different methods such as oral question, interviews, questionnaires, and checklists. We have direct observation. The best way that we can evaluate if a patient has learned if they can actually tell us in their own words, or they can demonstrate the teaching back to us.